My name is Annie and I'm one of the founders of Neighbourhood Midwives. We're an employee-owned social enterprise and we first launched as an independent midwifery provider in July 2013. Last November, as part of NHS England's Choice and Personalisation Pioneer programme, we were commissioned by Waltham Forest CCG to deliver a 2-year pilot providing our continuity of care service to women with straightforward pregnancies. 1 year on, and we have 6 midwives doing just that. This short film is to introduce Neighbourhood Midwives to you and to celebrate our journey so far. There is now plenty of evidence that what women really want is to know their midwives. They want to be able to build a relationship with someone they can get to know not only during their pregnancy, but through labour and birth and for those first important weeks afterwards.
I think the reason we chose Neighbourhood Midwives is so that we can get to know our midwife, have a much more personal experience when we do get to the point where we're bringing our new daughter into the world.
Building that relationship with 1 or 2 people and seeing, pre-baby, during the labour and then the aftercare, that's what was really appealing.
Working for Neighbourhood Midwives, I'm able to build a relationship with a client and actually get to really know her and for her to actually trust me, not under pressured environment. You have that full continuity of care and actually get to follow the woman through her whole birth experience, which is amazing. And you build up such beautiful relationships and you're actually part of a family, which is absolutely lovely.
The reason continuity is so important is because knowing a woman well is the safest way to provide care. With the same midwife looking after her, any changes in the woman's health during her pregnancy are less likely to be missed. And it makes it easier for a woman to contact her midwife if she has any concerns. To give this level of continuity over the long term, though, requires a different way of working if it isn't going to burn out the midwives who provide it. Neighbourhood Midwives aspires to be a teal organisation. What that means is that we have a strong organisational purpose. We're flexible, we can adapt to changing circumstances easily, and we encourage everyone to bring their whole selves to work, as mind, body and spirit.
For me, personally, it is a better way of working because I can better balance my work and my home life. It's working in partnership with the women, and it's also empowering the midwives to be the midwives they should be, doing all the things we're supposed to do as midwives, not just doing this bit or that bit or that bit. We're not a factory which kind of breaks things into small parts and then at the end of it you have a car. We work with people and people are holistic entity, so we have to see them as such.
A fundamental principle of teal is self-management, but with minimal bureaucracy and no hierarchy. Our midwives plan their own working week in a safe and supportive environment. They have 24-hour access to a clinical coordinator for advice and support. Regular team meetings and a very active WhatsApp group are key to good communication, building trust and enabling our midwives to thrive as autonomous practitioners. They can plan visits during the day around their family life, and 12 weeks holiday a year compensates for being available 24/7.
I chose to work this way as a case leading midwife to kind of build stronger relationships with the women I care for and to allow me to manage my own time. I can decide kind of when I get up in the morning and how many appointments I have that day, and it allows me to spend a lot more time with women if they need it.
With Neighbourhood Midwives, I'm on call with a person that I really get to know. So it really doesn't bother me whether I'm on call 24/7. And I look forward to that call because I know that we are having a baby.
In our base in the Cyberlink Children's Centre, we hold regular weekend antenatal classes. We have tea parties, reunions for new mums and their babies. And we have our scan clinic, which is run by Diagnostic Healthcare, and which our mums-to-be and their partners really appreciate for its calm environment.
Really impressed so far, with the service I've had, and I've only just, found out really in the last few weeks I'm pregnant, so just to have that straight away and have someone, taking my blood at home, that was amazing. I felt so relaxed. I had no bruising, I had no nothing. It was just simple things like that just make a big difference.
I don't feel like a member of staff in this organisation. I feel like I am, the organisation is me and I am the organisation, if you know what I mean. We're all part of a wonderful family with the same goals and the same vision and the same ideals, which is very much to keep the spirit and the skill and art of midwifery alive.
At Neighbourhood Midwives, we are following in the footsteps of a long line of extraordinary midwives. Over the decades, they have shown that midwifery-led, continuity models of care consistently provide great outcomes for mothers and their babies. In partnership with our NHS colleagues across the multidisciplinary team, we believe that it is possible to roll out models like ours across the country, transforming the culture and the experience of birth for women, for their families and for their midwives. Thank you to everyone who has contributed to this film and to making our first year such a success. Roll on, year 2.